Had our conversation in my office not too long ago, and we covered a broad array of topics. I've been interested in reforming healthcare in general to add transparency, competition to it. FDA specifically, I think we did cover some discussion on making it more agile, especially on maladies that don't have really good treatments out there. And you said you'd be amenable to that, and I like to hear that. This is a question I've asked since the origin of the COVID kind of navigation, and now we got a lot of data. We're lucky that we did have warp speed. We got the vaccine done. Looks like with variants, there are going to be renditions of it that we still need to tackle. Whether vaccines will be the only leg that we use. I've been a believer that it needs to be broader. The subject of therapeutics. Are you willing to put the same interest in developing therapeutics, especially in light of the fact that some either choose not to get it for the wrong or right reason? Where does that fit in your opinion, in terms of the relative importance, especially given the fact that it looks very difficult logistically? We'll get the world vaccinated in a way to suppress variants. How important are therapeutics, and where will you be, your posture, in terms of promoting that second leg, if not a third one down the road, in terms of protecting you against it in the first place? Focus on the therapeutics.
You know, I'm a cardiologist, so we're fairly well known in the medical community as being aggressive people with regard to therapeutics, and I think it's made a huge difference in heart disease that we have drugs and devices, many of which I've worked on in my career. And I think the same holds here. Vaccines are far and away the first line of defense, in addition to the behavioral measures that we all know about. But for people who are unlucky enough to get infected, particularly those that are high risk, the therapeutics are absolutely essential. I already made the point with Senator Romney, the therapeutic antibiotics have a 90% effect, and now it looks like we have oral antivirals that may also be in that category. But we got to stay on top of this because the virus doesn't really care about us. It's mutating constantly. And we got to have platforms that will produce therapeutics just in time for the variants as they come up. So therapeutics is a big part of the FDA. It's a big part of my history, and I will definitely work hard on this.
So I think from what you said there that you're willing to acknowledge that it's going to have to be a significant part of how we tamp this down over time, and I'm glad to hear that. Another question I have. Under your leadership in 2016, the FDA weakened the risk evaluation and mitigation strategy on protocols on mifepristone, hard to pronounce, but a drug that's used early in the stages of when you're entertaining an abortion. Recent study analyzed 423,000 taxpayer-funded abortions between 2002 and 15. And I've got a question. Do you think that we need to be in that relaxed kind of interpretation of that particular approach? Or is this something you're going to listen to current information and technology on so that you give a full kind of consideration of that particular methodology on abortions?
Well, as I've already discussed with Senator Burr, I do appreciate the question. There is a document filed by FDA in court about the evaluation of the data on mifepristone, and the reevaluation is imminent. I'm not involved in that particular reevaluation, but I can assure you the staff will be looking at the latest data and applying the best science and make the best possible decision. I have confidence in that staff, and I know them well.
And I think that's in the context of what we're seeing, even with what the courts are taking up in terms of trying to get to the proper balance on Roe versus Wade, and that issue is going to be out there. And I think to many Americans, it's an important, including the question I just asked. Madam Chair, I ask unanimous consent to submit for the record the testimony of an individual that experienced complications resulting from a chemical abortion drug.
Without objection.